Meet Lisa. She's ready to stake her claim in the world. Meet Harold. He's lived a good, long life and is ready to retire. Meet the national debt. Lisa and Harold have both heard about the national debt, but they don't know how worried to be. Our national debt is not new. You may be surprised that our founding fathers authorized a national debt to fund the Revolutionary War. In fact, in 1785, Alexander Hamilton wanted the nation to take on more. He said,
"A national debt, if it is not excessive, will be to us a national blessing."
So what is excessive? Well, we need to think about our ability to pay down the debt by looking at how much debt we have compared to how much we produce as a country. This so-called debt to GDP ratio. That ratio spiked during wars and the Great Depression, but our economy bounced back and we were able to get the debt back under control. Today, our national spending priorities have changed. In the early 1900s, the government spent a lot on defense and education, but today it spends more on health care and Social Security. It also spends significantly to cover the interest on the national debt. Having more debt and higher interest payments are a concern because these leave less money for other areas such as education and leave us with fewer options during tough economic times. When things get bad for an economy, government spending can be especially important. This last line of defense is only available, though, if the government has room to increase spending. Let's take a closer look at what our government actually spends money on. The budget has two broad categories: mandatory and discretionary spending. Regardless of priorities, the mandatory spending amount is automatically approved every year. This includes things like Social Security, Medicare, and Medicaid. Discretionary spending, on the other hand, must be directly authorized by Congress. When we look at mandatory spending, we can see why it is so hard to limit spending. These programs are the safety net to care for the elderly and the poor. Social Security is the main source of income for many retired people like Harold, and the largest program of any kind in the budget. Medicare and Medicaid, which help provide immunizations and treatments to the poor, elderly, and disabled, are expected to be the biggest causes of rising government spending in the future. This leaves discretionary spending, the kind which gets reauthorized every year. There are two big categories: defense spending and everything else. Military spending goes up during wars, and the conflicts of the past decade have been no exception, which means the cuts have fallen on everything else. Yet these programs include investment in medical research, science, energy, technology, and foreign aid. Without these investments, we wouldn't have put a man on the moon and wouldn't have developed search engines like Google. This category also includes basic investment in the roads and bridges we depend on every day. These discretionary programs have broad social and economic benefits. All of these things are being crowded out by health care, which is already 1/4 of all federal spending and growing fast. The way our government spends money on health care today, with lots of money for treatment but very little for preventive care, is a major problem for young people. Right now, only 3 cents of every dollar of healthcare spending goes to prevent conditions and diseases that could actually save money down the road. Young people would be better off physically and fiscally if the government spent more on prevention. Most government healthcare spending today comes from two major programs. The largest is Medicare, which helps pay for healthcare for all the baby boomers over age 65. A task which gets more expensive as more of them become eligible. The next largest program is Medicaid, which pays for health care for families and individuals with low incomes or disabilities. Despite the fact that the U.S. spends more on health care than any other country, we are not the healthiest. Why? One reason is that the government and many private plans pay doctors for how many things they do, not how well they do them. This means more procedures and tests, some of which don't make us any healthier. The U.S. healthcare system spends a lot on administration, like billing agents and insurance underwriters. This doesn't directly improve anyone's health. We also use more medication and more expensive medical technology than most other countries. Finally, long-lasting diseases like heart disease, diabetes, and cancer are expensive to be cured and controlled. Because these last a long time, everyone would be better off if we could delay or prevent these chronic diseases altogether. Besides healthcare, Lisa also faces a serious economic situation and high unemployment rates. The unemployment rate among 16 to 24-year-olds is double that of all other age groups. In addition, students are graduating from college with more debt than ever, up nearly 50% from 2004. Young people are unable to save, making them more likely to need government assistance in the future. And businesses suffer because fewer people have money to spend. So, you see, increased personal debt slows economic growth on the national level. The less money people have, the less they spend and invest. This, in turn, puts greater strain on the national debt, since the government collects less in taxes and spends more to help people who are struggling. This is where some national debt can be a good thing, if it helps break that cycle. But if left unchecked, it can make for a worse economy and fewer opportunities for young people. So why aren't our political leaders focusing on this problem? Actually, some of our representatives are trying to make this better. But politicians often respond to their constituents, and some constituents have louder voices and deeper pockets than others. These individuals and organizations can influence policy to a much larger extent than the average citizen or nonprofit interest group. Young people don't have a powerful organization to lobby politicians, and the result is that education and other priorities for young people are underrepresented on Capitol Hill. Spending goes to programs that benefit older generations as the debt continues to increase. The national debt affects everyone, young, old, rich, poor, so there's room for all of us to get involved. But how? The answer is simple. Young people can assert their voices by voting, participating in groups at school, or contacting their representatives. And they can reach out to the older generation to start a dialogue that may lead to a better understanding. Young people already have the potential to change America's political landscape and decide who wins an election. All they have to do is vote. In the swing states, the youth vote, without exception, far exceeds the margin of victory. This solution is free, easy, and simple. Voter turnout among young people has remained relatively low, hovering between 20 and 30% compared to the more than 50% for the population over 55 years old that cast their votes. It is no surprise that the result is a government which pays more attention to and spends more money on older people. Participation doesn't have to wait until Election Day. As young people, you can make a difference by helping with political campaigns, particularly by volunteering in person and by conversing with friends, family, and those outside your peer group about what matters to you as a young person. The barriers to participation are low, and the costs of not participating are high. Washington, D.C. can seem distant and irrelevant, but our political leaders have a huge influence over daily life. The national debt is a manageable problem, but the youth need to get involved and do their part. If we don't make changes soon, there will be severe problems in the years to come. But together, we can make a more equitable and effective national budget for today and for future generations. Let's talk with our friends, parents, grandparents, teachers, and co-workers about how the ever-growing debt is limiting new opportunities. Our voices will not be heard unless we are willing to have these conversations and to voice our opinions at the polls. We may not be able to sit down with the leaders of this country over dinner, but we can do that with those we love at home. Let's get educated about the debt, then come to an agreement of what's fair for generations to come. Together, we can manage the national debt.